Yes, I think so. I think we've noticed an improvement in the preoperative assessment part of the patient care pathway at Torbay, because we're now able to track where patients are in their pathway, whether they need further reviews or further tests done. And although we did that to some extent before, it was paper-based, and a lot of the tests that we did preoperatively were never reviewed before the patient actually came into the hospital, whereas now we can ensure that they are all reviewed, they're all acted on if anything needs to change, and so that we can sort of trace people through the process much better, and I think that's been a big improvement for us. I think one of the biggest things we've noticed since we've started using it, and which is very different to the system we were using before, is it is extremely flexible, and you can change many of the things yourselves. You have a lot of control over what content there is on different screens within both Customize and within the DB editor. You can change things very rapidly, you can add things very rapidly, and we've really appreciated being able to adapt as we've gone along, and rather than having to go back to a company and saying, oh, we want this field added in now, or we want this added to that pick list. We can sit down and do it ourselves as clinicians. If someone comes to us and say, we want X drug added to this protocol, we can review it, go, yeah, fine, we're happy to do that, and add it within 10 minutes. It's just much easier.